Dr. Rodman, here are three of the most common questions we get about implants. So number one, do they need to be replaced?
So facial implants do not need to be replaced. I think where people get that idea is breast implants, or I'm assuming that often need to be exchanged or swapped out. But facial implants, once they are in, if you are not having a problem, they stay there for the rest of your life and they do not need to be swapped.
Question number two, do facial implants shift or move?
They should not. So we don't want the facial implants to move, shift, flip, anything like that. In most cases, I will secure the implant down with a screw. There are a few implants that I will secure down with a permanent suture, but I'm always doing something to make sure that the implant stays where it's supposed to be.
Question number three, what are facial implants made of?
So there's a couple different options for materials, and which option is best for each patient depends on where the implant is, what they're looking for, and so that's something we talk about in our consultation, is seeing their goals and then trying to match the best implant material with what they need. But the three main options are, one is silicone, and that's what this one is right here. It's like a really hard rubber. It is not silicone like a breast implant, which is soft and squishy. This is really, just think of it as hard rubber. Number two is MedPore, and that is a much stiffer material. If you could imagine styrofoam, but that's made out of stone. So it's very light and porous, but it's rigid. And then a new material that has just become more popular is titanium. And so that's a metal implant. It's made out of a metal mesh, and it can be made custom to each patient.